Hi there, it's Dr. Kelvis with Liberty Family Medicine, and I am here to go over the most current COVID prophylaxis treatment recommendations. Now, we all are familiar with fake news but ask if your physician practices evidence-based medicine. So, at least for me, I keep up with Homeland Security. I look at the actual published material. So, for example, for the longest time, we saw there was observational evidence that hydroxychloroquine worked. But when randomized controlled clinical studies were actually performed, there was no benefit to giving hydroxychloroquine. So keep in mind, correlation does not imply causation. So what was most recently published by Homeland Security on December 8th, there was a critical care task force that looked at for months, all this research. And, they came up with a lot of very important vitamins, vitamin C, vitamin D. There's so much literature now to show how vital vitamin D is in supporting your immune system. All my patients here are low and deficient. And whether that's, lack of vitamin D in their diet, we're eating more processed foods than ever before. Also, for the drug to, or for vitamin D to be activated, you have to have sunlight. So for sure, if you live in a colder place during the winter, you're not going to absorb enough of that vitamin D. The Homeland Security Task Force, they also recommend taking zinc every day. And there's actually, and again, the melatonin suggestion might be more of a correlation. We're still waiting for more information on that. But patients that are actually taking melatonin every night have better outcomes. Um, and then quercetin once daily. So quercetin is typically prescribed for allergies. It's a very natural vitamin, like an antihistamine. Actually, I have my bottle right here that I take every day. Um, and what the studies are showing is that patients on that tend to fare better when they have COVID. Um, so ivermectin is currently, but they're calling it the miracle drug. Um, I'm impressed with the studies that have been done and published. A lot of them were done in Central and South America. I really appreciate that Homeland Security looked at everything globally. Um, with ivermectin, though, it's not technically FDA approved to treat COVID. So there are still as of right now, I'm doing this December 21st, 2020. There still might be some physicians that are very hesitant to prescribe this. Ivermectin has a very low side effect profile. You give it to the patient on day 1 and then day 3. In the ICU, there's benefit to giving high doses of steroids. There's been no clinical benefit demonstrated in giving steroids to patients outpatient. So if they're mild COVID cases, they're tired, they're not feeling well, that's not necessarily an indication to give them steroids. Steroids is going to be on kind of as a per needed basis because steroids have a much higher side effect profile. Um, like if you have diabetes and you're going to be on high doses of steroids, you need to be in the hospital because steroids will make your sugars go sky high. So I'm very careful about who I give steroids to outpatient. Also, putting anybody on steroids long term can affect your adrenals. It affects everything in the body. Um, so let's see, and then aspirin. So what we're finding with COVID is that it's causing this clotting cascade in patients. We don't know why. There's some literature showing there's association with blood types. Hopefully, in the next couple months, we'll have more light on that. But they're recommending that you go ahead and just start on aspirin. I would still recommend asking your doctor, though. Aspirin is contraindicated in a few disease processes, or, if you're already on a blood thinner, there may not be depending on what the blood thinner is, there may not be a reason for you to take additional aspirin. Um, Again, with all of these recommendations, that's all they are right now is recommendations. It's all we have. This is a new novel coronavirus. And so far, patients that are on these medications are faring much better than people that don't.